Good morning. I'm Katie Tate, a section manager at the Transplantation Society. Today I'm joined by Dr. Lucy Sullivan, our Scientific Programme Committee co-chair. Lucy, can you tell us a bit about yourself?
Hey, I'm Lucy Sullivan. I'm the co-chair of the SPC for TTS in Sydney, and I'm located in Adelaide in Australia, in South Australia, where I am the scientific director for the Transplantation and Immunogenetic Services at Australian Red Cross Lifeblood. Well, of course, for me, the most exciting thing is that it's in Australia. So to see TTS in Australia is really super, super exciting again. And secondly, in developing the program, I think it's probably the panel sessions that I'm most excited about, where all these smart people with different viewpoints can shape a really exciting dynamic session together, which is obviously collaboration in action.
So maybe you can describe a little bit about how the programme came together, i.e. what were the big building blocks from day one to the final programme?
Right. So it's a really big balancing act where we have obviously some very clever people behind the scenes who help us, but it's a big matrix to make sure that we balance everything. So clinical and basic science and sort of mature ideas and emerging themes, and then organ specific versus more of a cross-cutting. And we always are very conscious to layer on top of that gender, global representation, and career stage across each session. So I guess for us, like if a proposal, for example, was outstanding but not really balanced in the program, we'd look to pair it with a complementary session and reshape the format. So with the idea of at the end, hopefully we have a really involved program that moves the whole field forward and was relevant to all people working in transplantation, whether you be a clinician, a scientist, a coordinator, a nurse, or an industry partner or a trainee.
So, from a personal highlight, what part of developing the programme did you enjoy the most?
Oh, like I said, it's very complicated working with a matrix. But look, I've enjoyed working with people that I haven't met before as well, and having to come to a view that is consensus across everybody, and learning how to compromise and learning how to factor in a whole lot of different needs has been it, but it's been a really, really rewarding process, and it's an absolute privilege to be the SBC co-chair.
So, if someone were to ask you what will feel special this year, what would you say?
I think, as you've mentioned, it's about, I guess, energy and access. So there'll be more voices on stage and more structured chances to meet collaborators and more space for collaborations to develop that cut across organs and different disciplines. So the program's, I guess, designed for it to be niche enough so that you can deep dive into that, but then to also be able to come up to for air to connect with the broader transplant community.
We're really excited to be able to offer 1,000 oral presentations this year. Why is that important and what does it change for attendees?
Well, it's super important because ultimately great science deserves to be heard, guess not just posted. So expanding the oral slots means that more early and mid-career investigators get real-time feedback, and we can also have people from more diverse geographies represented in on the mic, and the attendees can sort of see the figures and as well as hear the argument for the science being presented. So I guess it's more about more richer choices for the delegates and more discovery moments as well, not just those headline acts that can often be represented at other bigger conferences.
So, for our early career members, what's your advice to turn an abstract into an impact moment?
Ooh, I guess start with the why in a single sentence, and to show that one result that you hope will change people's thinking, and ultimately to end with the audience thinking, "Oh, what can you do next?" So keep the sides clean, keep a really sort of clear, crisp story, And ultimately, at the end, also invite people to be involved. So, if you want to be involved, if you want to discuss, please come up to me afterwards. So that can really, I guess, be a project catalyst and change it from not just a presentation, but into a bigger piece of work.
So, TTS and TSANS this year are offering many awards tied to abstract submission. Why do you feel this is important?
Well, I guess as you've mentioned, so people who are submitting abstracts, so especially trainees, allied health professionals, and residents from emerging economies should definitely be looking at the scientific awards. So these awards will recognise excellence, and they also, so obviously, they help to offset the travel costs. And most importantly, it will signal that your work matters to the global community. And of course, we invest because visibility and access ultimately accelerate career and great science.
What do international congresses bring that national congresses can't?
I guess a true diversity of practice and perspective. So we can ultimately see how similar problems are being solved in different parts of the world that might have different health systems. And we can discover data sets and approaches that we didn't even know existed, and to assemble collaborations that are really only possible when people are in the same place, albeit from different walks of the transplant community. So surgeons, physicians, scientists, coordinators, and industry all in the one place.
What opportunities do you think this Congress will give to people from Australia and New Zealand?
Well, I mean, not only opportunity to showcase our talent, which will be obvious from the Congress itself, but to showcase our country, and particularly, it's in Sydney. And so outside of the Congress, I hope that people take the time to enjoy the beautiful country and the landscape we have, and also the stories we offer. So Sydney is this beautiful mix of natural beauty, but with real cultural depth. And I think I'm maybe a bit biased, but something that you wouldn't really find elsewhere in the world. So the iconic sights of Sydney, the Harbour Bridge, the Opera House, and the ferries that go across one of the world's most amazing natural harbours. And then the Congress itself is so beautifully placed. Within minutes, you could be on a coastal walk and looking at sort of sweeping coastal views, and or even a simple pleasure like just enjoying a coffee. We are a deeply coffee obsessed nation. So please go to your local coffee shop when you're in Sydney and try a flat white or something else that might take your fancy.
Can you give us an example of an unexpected collaboration that people might have at this Congress?
Oh, I guess it's the collaborations that you don't expect. So you might, for example, meet up with somebody who's working on AI and a big data set, and they might come to your talk and say, "I've got something that I think can help you get to the next step." And it's just like, whoa, that completely different perspective, I think, is what I find truly remarkable at meetings like this.
So, when the meeting is over and attendees fly home, what are three takeaways you hope they have?
Oh, three takeaways. I hope that they leave with one scientific idea that they didn't have before. I hope that they've met one new collaborator that they can genuinely work with moving forward. And I hope that they have identified one practical change that they can make, whether it be a protocol, a checklist, or adding a different analytical tool, for example, that they can implement, and remember TTS for being that defining moment for them.
So, the ICC is a world class centre. Can you tell us a bit about the centre and the surrounding region?
So as I've already mentioned, Sydney obviously is one of the most beautiful cities in the world. But as for the ICC itself, so it's purpose built. It's a very modern venue. It's got flexible rooms and a sort of an intuitive way of finding your way around. And it's a very walkable precinct as well. So that Darling Harbour area keeps the Congress, I guess, more intact. So delegates aren't scattered all over the place. They're walking on the same waterfront and they're crossing paths between sessions and continuing those conversations over coffee or dinner, which is all just a few steps outside of the Congress venue itself.
What are the key commitments you want people to understand?
Key commitments. So, first and foremost, TTS is an in-person event. There's no virtual abstract presentations. Presenting authors must be registered by June 23, 2026. Otherwise, they risk their abstracts being removed from the program. And as for abstracts, the deadline is March 19, with the acceptance notifications being on the 8th of June 2026. So I guess we're being very clear to be upfront about those about those timelines so that people can plan their travel, get their visas, and get their funding without any surprises on the timelines for those things.
Okay, thank you very much, Lucy. We look forward to seeing you in Sydney, Australia.